Namaste everyone and welcome to this very special panel discussion on the occasion of World Retina Day. India today stands at a historic moment, a fast-growing economy with an ambitious vision of Viksit Bharat by 2047. Over the past decades, thanks to strong national programs, we have made remarkable progress in terms of many health indicators and eliminated several major diseases. Yet, when it comes to eye health, India continues to be called the blindness capital of the world. It is home to nearly 1/3 of the world's blind population. What's even more concerning is that we are seeing a surge in vision loss among people in their most productive years, something that affects not only individuals but families, their livelihoods, communities, and also, most importantly, our national productivity. One of the biggest problems is that when we talk about eye health in India, the conversation almost always is centered around cataract and glaucoma. Make no mistake, these are also very important issues, but they do not paint the whole picture. Before we get to the heart of the matter, here's a closer look at the looming crisis. It's time for me now to introduce you to our panel of experts. Rajwinder Medwan, CEO and MD, Roche Pharma India. Dr. Kim, President of VRSI and also the Director of Aravind Eye Hospital. Dr. Vishali Gupta, who is the Vice President VRSI and Head of Retina PGIMS. And Dr. Manisha Agarwal, who is the General Secretary at VRSI and also the Head of Retina at Dr. Shroff Charitable Eye Hospital. To all our guests on the show here, welcome to the program. Let me start with Dr. Kim here. Every time you talk about eye health in India, the conversation is usually around cataract and glaucoma. And like I said, these are also very important factors. But again, what are the other common causes of blindness? I mean, we're talking about a nation that is now being spoken as the blindness capital of the world. This is not a title that we are proud to have, but again, what are the main reasons?
That's really unfortunate. Most people are aware of what you said, cataract, that is Safed Motia. But what you have to understand is what we see in the front is just 1/3 of the eye. 2/3 of the eye lies behind the back of the eye, which is where a lot of diseases, what we call as retinal diseases, happen. We have problems like diabetic retinopathy, we have age-related macular degeneration, we have retinopathy of prematurity in children. These are all. The problem with the retinal disease is they are undiagnosed until it is too late when people get symptoms. So that's the scary part of it. So people actually present much later, and that's the problem. And just to give you an example, a problem of 101 diabetics in our country, which is a huge, and each one has a potential to lose their vision to the condition called diabetic retinopathy without they realizing it. That's the scary part.
Absolutely.
So similar conditions exist, and the cost to the nation, as you mentioned, is huge because of that's a condition we have to worry about and we have to address early on.
Dr. Vishali, I'll come to you now. Help us understand what exactly diabetic retinopathy is, what exactly happens in this condition, and why is this such a massive issue? And more importantly, why are governments or even people, policymakers, not talking about it as much as it is needed?
Okay. You are young. If I take you back to the era when we did not have digital photography, we had the cameras, the Polaroid ones. So there used to be a reel, a camera roll, and you would know how important that roll was if you wanted to get a clear picture. The lens, everything did not matter if your roll was exposed or bad. And that is retina to the human eye. Human eye is like a camera, retina is the roll, so you need a very clear, crisp roll to get a good image which goes to the brain. What happens in diabetes is your blood sugar levels are high, uncontrolled, so the blood vessels which should not be leaking, they start leaking. So that roll at the back or the retina is no longer transparent, there is fluid accumulation, those blood vessels close, So nature attempts and forms some abnormal new vessels to compensate. But those are abnormal vessels, they bleed. They cause visual loss, the retina gets detached, and eventually blindness. Blindness is invariably 100% if you are not able to tackle it. Now your question is, why are we not paying much attention? The attention is, if you look at the camera, everybody cleans the lens from the surface, isn't it? Like you would just take care of the dust on the surface, but you will not really always check for the integrity or the clarity of the roll because it's more complex. Similarly, retina is not something which is visible to everybody, which is visible to every doctor or to the patients, so they don't care about it. Everybody is so much intimidated by a huge focus on cataract that we forget that there is more to life and to eye other than cataract and glaucoma.
You know, Dr. Manisha, I have to come to you on this. The problem is, at the end of the day, the template that a lot of people in India follow these days is anything to do with an eye. You have a lot of free tests, you know, at optical stores. You go there, they give you some numbers, you get a glass and you think it gets solved. But diabetic retinopathy is much deeper and a much more serious issue than that. What exactly are the cause and symptoms that even people who are watching right now can actually identify and realize that what they're having is not just a minor issue with their eyesight, it's actually something deeper?
So I think that's a very important question, and we really need to have a clear understanding of how the diabetic retinopathy affects our vision and the eyes. Now, if I was to talk about the symptoms for anybody to recognize that I'm having diabetic retinopathy, you would actually turn around and be very surprised on my answer when I say, actually no symptoms is the most important symptom of diabetic retinopathy. And where I'm coming from is because diabetic retinopathy, it's known as a silent killer of your vision and the eyes. That means that despite the patient having diabetic retinopathy, may actually not have any symptoms. And that is why people take it very lightly and they say, why should I bother? Why should I get my eyes checked? They just walk into an optical shop, take a new pair of glasses, which can be very branded and very expensive. But believe me, that's not the end of the story. There's much more to it. If we were to wait for the symptoms to develop, probably it's actually a more advanced stage of diabetic retinopathy. And the various symptoms that anybody can encounter can be as simple as they can just turn around and say, आज मैंने सुबह अखबार उठाया और मुझे अखबार साफ नहीं दिख रहा था, वो छोटे अक्षर मैं नहीं पहचान पा रहा था. Now, somebody can say, what is the big deal? Anybody above the age of 40 requires a pair of reading glasses. I'll get a pair of glasses, go to an optical shop and start reading well. But what we need to understand is that despite getting the best branded pair of reading glasses, you still will not see clearly. And that is how you need to differentiate whether it is just a regular reading vision problem which you get above the age of 40, or is it because of the diabetic retinopathy? And that is something very important for all of us to remember. The other symptoms, of course, can be you can see some black spots or red spots flying around in front of your eyes. There could be a blurring of vision. Even gradually it starts setting in that you are not able to see the TV very clearly. Even the distant vision starts becoming blurred. Or one bright day, like Dr. Vishali mentioned, you can have a massive hemorrhage inside the eye, causing a sudden blackout, and you are, very shocked. What happened to my vision? I was seeing so clearly yesterday. So these are the various symptoms a person needs to recognize and get a thorough eye examination done. As far as the signs are concerned, well, you can have these various spots of hemorrhages over the retina. You can have new blood vessels forming because of diabetes on the retina, which gradually spread on the surface of retina, start pulling it and detaching it. Believe me, that's a very advanced stage of diabetic retinopathy, and we don't want anyone to reach that stage.
What are the sort of issues that I need to be aware of? And also, most importantly, how do we address this entire issue?
It's been said, and unfortunately, we are the diabetes capital of the world. And it is a big problem, as said by many of the panelists, because it's an invisible disease. It's a silent disease. So 85% of people who are living with diabetes are not aware that their eyes could be at risk, that they could turn blind. And what happens then is what you see, about 150 patients every day walk into a clinic and a doctor has to tell them, you could lose your sight. And 50% of these individuals do end up losing their sight, which is really unfortunate. And it's because of all the reasons, as Dr. Manisha pointed out, because the symptoms are just not there. It is silent disease. So it is a big public health problem. Now, we can address it. We've done this before. We have eradicated polio. We have eradicated smallpox in this country. Cataract used to be a massive disease, which we've made a big difference to in the last few years, right, where it's very treatable, it's very catchable. We can do that again here. What it requires is three things. It requires the public to know that, look, I'm someone suffering from diabetes, my vision, my eyes could be at risk. Lack of awareness. But beyond that, if I as a patient, I'm a diabetic, and now I know that my eyes are at risk, where do I go for screening? We do not have screening guidelines that mandate that a patient has to go every 6 months or every year to get screening. We do not have the right diagnostic tools that are available to patients. If I live in a rural area, how do I get access to good diagnostic things? And then, okay, fine, I get diagnosed, I know I'm at risk for this. Can I access good treatment? That's not available to us as well. Right. So I think it's multiple parts of the system that we have to fix to make sure that this gets addressed. It requires good screening and good diagnostic methods. And finally, it requires good disease modifying treatments to be available to our patients. So our patients in India, they deserve the best treatment. And that's what we have to do, is connect all those three things. And I'm very optimistic we can address
Absolutely.
this.
Dr. Manisha, I need to come to you on this. Can you help us understand how crucial early diagnosis is, and if a patient does not detect it early, how dangerous can this be?
So that's a very important thing. Like we've all been mentioning, that it is a silent killer of your eyes and of the vision. If a patient is not getting diagnosed in the early stages, and if they wait for the symptoms to develop, there would be a very high element of an irreversible loss of vision. Now, when I say that there is an element of irreversible loss of vision, it means that already the diabetic retinopathy has already advanced to a very later stage. And when this happens, it actually is going to be requiring a more complex management. There is going to be a much higher cost involved in the management.
In your experience, can you share a few examples where this has happened, wherein a person, probably did not have diabetic retinopathy that would have endangered how they, experience the world, but because of the lack of early diagnosis, the case went to a level where it's virtually untreatable. Do you have any such examples?
Absolutely. Like, the age-old belief has been that diabetes is a disease of the elite class. But I think none of us believe that in today's time. I had this one young 45-year-old gentleman who had actually migrated from Jharkhand to Delhi just for a better living. He had to support, he was the sole bread earner of his family. Now, when these people migrate from rural parts of our country and they start coming and living in the cities looking for a job, there's an entire lifestyle modification. They're no longer carrying that kind of a lifestyle. They're not having that kind of a diet, which they probably would have had it in their villages. So now these are the people who are again prone to develop diabetes and diabetic retinopathy. So this young gentleman, 45 years old, living on the streets, making a living for himself and for his entire family, by the time he walked into our clinics, was actually about 60% blind. And you can well imagine that he has come with a certain aim of making a living, and he's no longer able to work. It's not only that particular individual who's getting affected, it's the entire family who was dependent on his earning has got damaged. And like we mentioned, that this is a disease primarily of the working age population of our country. At the end of the day, it is having an impact, it is increasing the economic burden.
Dr. Kim, coming to you here, in terms of policy, infrastructure, skills, this is something that has been done in India in the past as well. Polio, smallpox, we made sure that people in rural areas, places that don't really have connectivity, those people are treated as well. Why does that not happen when it comes to diabetic retinopathy, and what exactly are the sort of tweaks and changes that the government needs to do?
Awareness is so poor in our country. We have had doctors who you think would know everything come and present to us with loss of vision due to diabetes. They've been treating their diabetes but never bothered to have an eye exam.
So you're essentially
done.
saying that the doctors who are supposed to be the first point of contact for a patient, supposed to make the patients aware, are themselves not aware of this issue.
Sometimes, they are not aware of it, and this leads to really, very sad. So how do you expect a lay person to present themselves? So that's how grave the situation is what I'm trying to say. And then talking about diabetic retinopathy, today it has evolved so much. The technology is there for both diagnosis, screening, and also for treating. Good treatments are there, but unfortunately there's a lot of gap between what is there and what people can access. So if there are ways that government can find to implement those procedures and processes, the policies, then it is likely that every patient will get an eye exam done, and it will ensure that early treatment or early addressing of diabetic retinopathy can be done.
Well, it's an AI world that we're living in, and when you talk about gaps, in terms of diagnosis and also treatment, how do you think AI or other such technology can actually be used to bridge those gaps, to ensure that diagnosis, because we have the pipeline, we have multiple health missions running across the nation, so we have the patient pipeline. How do we incorporate technology to ensure that diabetic retinopathy also is included when it comes to the diagnosis?
It's very interesting you asked this question, because today we are in a technology era, and it is easy today for every diabetic to get their eye screening done at every single opportunity wherever they go, be it they go for the diabetic examination, they could just get a fundus photo taken, and that AI can help to read those fundus images, and there's no dependency on any ophthalmologist. Or earlier it was, maybe 5 years before, it was a challenge, but today with AI that's available at every physician's office, or even labs, like a patient can go get a lab test done, they can even have a eye exam done just with using a fundus camera and using AI. It is possible that they can screen themselves.
Brings me to the question, Rajwinder, about what companies like Roche are doing in this regard. How are you ensuring that technology in this space, with all the advent of technology, you now have AI, you have a lot of data as well with the various health missions run by the government. How do you leverage all of that to ensure that on the ground, every single person that deserves a proper treatment, especially when it comes to something as complex as diabetic retinopathy, is taken care of?
So science is advancing, right? It's exploding.
Right.
And we've seen such progress in treatments for diabetic retinopathy, and that's our job, and we need to continue to do that. We need to continue to innovate as scientists and make sure, to your point, that our patients here in India get the best treatments. So that's where our focus is. I would also add, we need to then make sure that those treatments actually reach patients. A really good treatment that doesn't get anywhere. So that's also part of our responsibility. How can we work with governments? How can we work with physicians? How can we work with hospital systems to make sure patients in the far reaches of the country can access our treatments?
Dr. Manisha, what can the patients do to treat themselves better? Because while you still wait for proper diagnosis, a proper detection of what your issue is, how can patients take care of themselves until then?
So I'm glad you asked that question, and I have a very simple 3-step approach which any patient with diabetes can actually follow.
All right.
And that simple approach is that, one, you have to start demanding that I have to get my retinal examination done. You really don't need to wait for the symptoms to develop. You really don't need to wait for anybody to ask you to go ahead and get a retinal examination done. It is your right to get your retinal examination done, and it's high time that you started demanding it. The second step is going to be that have a very good control of metabolism. That means a good control of diabetes, which not only means a good control of your blood sugar levels, but it means a good control of hypertension, cholesterol levels, your kidney functions. If you keep a tight check on that, I'm sure majority of the complications secondary to diabetes, they can be avoided or they can be kept under control. And the third step, of course, is going to be that you have to strictly follow the advice which is being given by your doctors. You have to respect that. So if your retinal expert is saying you have to come back for an examination again after 6 months or 1 year, you have to respect that. You can't make it 6 years or 10 years, because that's going to be too late and you would have already lost a significant amount of your vision.
But that's exactly where you also need the medical community to also step in. Dr. Vishali, that was going to be my next question. How crucial is the role of the medical community, the diabetologists, the physicians, to ensure that when a patient comes to them, they also make sure that the retinal side of things are also taken care of, and they immediately refer the patients to a retinal screening if required? Because at the end, what we see, like Dr. Kim also mentioned here, is that a lot of doctors themselves are not really aware of how complicated the situation can be.
You know, when we talk of diabetes and its complication, we talk of diabetic foot, we talk of heart attacks, but we don't talk of retina in the same breath.
Right.
So the knowledge is not as widespread as for other complications. So when a person comes to a diabetologist or an internist or anybody, that is like their primary school teacher. So the patient is going to listen to what that doctor is going to tell them. So if the doctor casually says, okay, get your eyes checked, he will walk into a refractionist shop and get his glasses checked. And we did this study, there are a lot of barriers. One, patient doesn't have any problem. Second, his attendants don't want to take him for retina checkup because they just feel that you are fine, you have no problem, simply because doctor said you can't. So we need to have a very good referral integrating the primary physician along with the retina, so that the primary physician can actually tell the patient where to go.
Absolutely.
And why is it important, and in the local language.
How does the government ensure that the importance of diabetic retinopathy is taken care of, and also there are policies that are in place to ensure that something as crucial as this, that can actually help us get rid of the title of the world blind capital, the capital of the blind in the world. Yeah. How do we get rid of that?
One of the important thing is to include this. We have a non-communicable disease program. If we can include eye examination as part of the non-communicable disease program, that will go a long way in identifying patients early on. And then also make eye exam mandatory for every diabetic who's diagnosed to be diabetic. They should have an eye exam done.
Right. So the mandate is what he says is important. Dr. Vishali, what's your recommendation, your closing remark? Everyone who's watching right now, what's your suggestion?
Diabetes बीमारी नहीं है. Diabetes एक जंग है. And when the country is at war, no one person can win a war. It has to be armed forces, it has to be a common man, it has to be government. So similarly, if we want to fight diabetic retinopathy, it has to be a collective effort from the patient, from physician, from retina specialist, ophthalmologist, from the government, from NGOs. Let's all work together. There is nothing to be proud of saying we are the world capital. It's a shame, and we have to get rid of that curse.
And Rajwindra, what's your message?
We have to make this a priority. The cost of not doing so is too much. Being able to see is just a fundamental human thing. So lost hopes, lost dreams, can't afford that. If you put it in economic terms, as Dr. Kim said earlier, 50,000 crores is what we lose.
Dr. Manisha?
I just want to give a message to each and every patient with diabetes who's watching this show today. You need to become selfish, and you have to start taking care of your eyes. Don't give that onus to somebody else. It's your eyes, it's your vision, it's your life. So you have to start demanding a retinal examination. Every time you are seen, you have to be careful when is your next retinal examination. जैसे एक चोर आपके घर में एंटर करता है चुपचाप और चोरी करके चला जाता है, उसी तरीके से ये डायबिटीज़ है जो चुपचाप आपकी आंखों में एंटर करती है और आपकी रोशनी लेके चली जाती है. ऐसा मत होने दीजिए. I would just end by saying that you have to have a yearly check of your retina and see clearly throughout your life.
Absolutely, and I think one of the most important aspects that we've discussed here on the panel has been how invisible this problem is, yet it is so visible that the youth of the nation is suffering from it, and yet we don't really see this being discussed in public forum at a scale that it deserves to be discussed on. And also it's more important to ensure that you don't just get yourself treated, but you get yourself treated at the right place and for the right disease. Thank you.